Hi, my name is Cora Sweeney. I'm a nurse practitioner student for Maryville University. This is my daughter, Aubrey. She's 18 and has agreed to be my patient for the day. Aubrey has emptied her bladder. We donned a gown. She's got some shorts on underneath. We obtained a full set of vitals, got height and weight. We tested her distance vision with the Snell chart and her near vision with the Rosenbaum chart. I washed my hands, and now we're ready to begin the head to toe physical, and I'm going to inspect her head and face. I'm examining the skin and the hair and the symmetry of her eyes and her ears, looking for any abnormalities, any anomalies, moles, lesions. Need to assess the hair follicles for if they go through nice and easy, the hair is not falling out, good hair distribution, and no alopecia. Okay, we're going to assess her cranial nerves. We're going to be looking at the preocular. I'm inspecting and palpating postocular, occipital, tonsillar, submandibular, submental, okay? I need you, okay, can you clench your teeth for me, please? Very good, and we're going to test, I'm looking at your temporomandibular joint, and when you clench your teeth, I don't hear any popping or clicking. Is it sore to you at all?
No.
Okay. And can you close your eyes and wrinkle your forehead? Okay, you can open your eyes and then wrinkle your forehead. Smile. Stick out your tongue. Puff your cheeks. And we've already palpated the scalp and hair and the facial bone, so that is all set. We're going to check your sinus regions. I want to check the frontal. Does that
No.
the ethmoid, and the maxillary sinus region. Okay, palpation is complete. We are going to now do the test light sensation. I'm going to take this Q-tip and I'm going to go on the left and right side of your forehead, your cheeks, and your chin. I want to know that you feel this equally and you have a sensation. So this is your left side. Do you feel that?
Mm-hmm.
Okay, your right side.
Mm-hmm.
Your left side cheek. Your right cheek.
Mm-hmm.
Your left chin. And your right chin.
Mm-hmm.
Okay. That concludes the head and face exam, and now we're going to start with the eyes. We are doing an external examination of the eyelids and the eyelashes. The eyelids need to be going, the distribution of hair needs to be equal and going out, as well as eyelashes you have eyelashes on both upper and lower lids, and they are going in the right direction. And now I'm going to check your sclera and conjunctiva. I'm going to pull down and check for any anomalies, and it's nice and pink like it should be on the left eye, and I'm repeating the same assessment on the right eye. Next, I'm going to palpate the lacrimal apparatus. Is there any soreness, tenderness? Okay. Okay, can I have you sit straight and find a point on the wall and cover your eye, your right eye, please, with your right hand. Okay, now remove your right hand. Look, I'm looking for any jerking, and I'm going to have you repeat this with your left hand too. Find the spot on the wall. And remove it. Looking for any jerking, nystagmus, and you kept your eyes straight at the point and everything was normal. Okay? All right. The next thing I want to do is check your cardinal field of gaze. What I need you to do is I am going to have you, we're going to use the light. What I need you to do is follow this light without your head moving. Okay, I'm going to come down a little bit to your one more time. Nice, normal, smooth movements with your eyes, no extraocular movement. Okay? Okay, we're going to check configuration. I need you to put your right hand over your right eye. I'm going to put my right hand over my right eye, and I want you to tell me when you see my finger come into your vision.
No. No. No.
Okay, can we switch? Okay.
No. No. No.
Okay, good. Okay, so now we're going to move to the ears. I'm assessing for alignment and placement of both of your ears. I'm looking for any anomalies again, any moles, any lesions, any breaks in the skin, and they look great. Hawaii depth with palpating the auricle. I'm going to go behind you and I'm going to whisper 2 words, one on your left side, one on your right side, and see if you can hear me, okay?
Boat.
Dog.
Dog.
Very good. Next, we're going to use a tuning fork, and I am going to, actually I would prefer to use this one. I am going to hit this on the palm of my hand, and then I am going to place it in the mid-sagittal region of your head. I want you to tell me if you hear the noise on the right, the left, or both. Okay, I'm going to do this. There's one more test of the tuning fork. I'm going to hit it again, and then I'm going to put it on your mastoid bone, and then I want you to tell me when you quit hearing the noise.
No.
Okay, good. And that's about double the time from the Weber to the Riemann, and that would be normal for hearing and air conduction. Okay? I have my otoscope here, and I just want to look at your tympanic membrane and make sure it's nice and healthy. Okay, and I'm pulling up and out of the auricle so I can see it, and it's nice, gray, pearly. And I'm going to be doing the left ear, pulling the auricle out, up and out, and the tympanic membrane again is nice, gray, pearly. Very nice. Okay? Now we're going to be moving to the nose. We're going to be looking at the nose structure and make sure it's symmetrical and the position is correct. I'm also going to be looking inside the nose, inspecting inside. The nasal mucus is nice and clear. The septum is symmetrical and the hair distribution is equal on both sides. And next we're going to look at your mouth and pharynx. Oh, for your nose, can you occlude one side and blow out? Okay, and the other side? Okay, and repeat and suck in and make sure that you have,
Like that was my...
or occlude each side. One side. There you go. Can you breathe in now?
Yeah.
Okay. Yeah. Okay, great. Okay, good job. So now we're going to be like opening up your mouth and checking your lips we're going to inspect your lips for symmetry, as well as make sure there's no cracks or fissures. They're nice and pink, plush. Okay, and we're going to open up your mouth, look at your mucous membrane, the buccal area, the gums. Your gum liner is not receding. There's no redness, no bleeding. Your teeth, your hard and soft palate. Can you open up this? Wonderful. Checking your teeth for color, character, quantity of teeth, any missing teeth, broken teeth, notable cavities. I don't see any nice teeth. We're also going to be assessing the posterior. Okay, open up all the way. Right. Posterior pharynx, the uvula, your tonsils, and you have no mouth odor. And I'm going to test your gag reflex. Can you say ah? Okay. Very good. And now we're moving to the neck. I'm going to be inspecting the smoothness of your neck and your thyroid, checking, looking for any JVD. There is no JVD. There's no goiter. There's no extra pulsation. Okay, and I'm going to come around here and I'm going to make sure that you, I'm going to test your thyroid. I'm going to move a little bit to the right. And can you swallow for me, Aubrey? Good, nice and smooth, no anomalies there. Okay, we're going to check your passive range of motion and active range of motion. What I want you to do is I want you to take your head and tip it down to your chest. Then I want you to go and tip go ahead and put your back up. And then your right ear to your right shoulder, left ear to your left shoulder, and then go all the way back. Okay, and then I want you to shrug your shoulders. Okay, this time I'm going to put my hand on your forehead and I'm going to have you push against it going down. Okay, over here, push against my hand. This side and back. So nice head strength. Okay, now your shoulders, I want you to try to shrug them up. Good. All done. Okay? That was good. Okay, next I'm going to palpate your carotid separately, as well as your thyroid. Good. Okay. One tracheal position is midline. It is not deviated. And then your lymph nodes. We're going to test your lymph nodes, okay? We're going to do your pre- and post-ocular lymph nodes, your occipital, tonsillar lymph nodes, submental, submandibular, superficial cervical chain, posterior cervical, deep cervical, and then your supraclavicular. Okay? Next, I need to auscultate your carotid arteries, okay, with the bell of my stethoscope. And I need you to hold your breath. Okay, go ahead and breathe. Thank you. Okay? Okay, we're going to start with the upper extremities. I want to inspect and palpate all of your skin, the color, your musculature and the temperature of your skin. And your hair distribution looks good. We're looking at your shoulders, going down, your arms, your hands, your nails. You have nail polish on, but I believe you probably have brisk capillary refill, less than 3 seconds. There's no clubbing. There's no cyanosis. Nail bads are pink. I'm going to go ahead and palpate your brachial pulses and your radial pulses. And I'm noting both intensity and amplitude of these pulsers. They're good. Okay, what I want you to do is, can you turn around? Okay, and I'm just going to go ahead and undo this and you've got pink eye on. Okay, so I'm going to look at all your skin for lesions, masses, any like abnormal moles, breaks in the skin. Hair distribution is even. I'm also assessing the respiratory rate and rhythm. The rate is 18 or less. The rhythm is non-labored, and there's ease with symmetrical chest rise and fall. Okay? Okay, we're going to palpate, we're going to inspect, palpate, and percuss the costovertebral angle with indirect percussion that should not elicit pain. Okay. I'm noting thoracic configuration. Anterior posterior diameter is 1 to 2. Now we're going to begin with the lungs. We're going to inspect your respiration and palpate. Okay, I'm going to check expansion. I'm going to go to the level of the 10th rib. Hang on one second. We're back. And I'm back. Okay. I'm going to go down to the 10th rib. Okay, and I want you to hold your breath. Can you hold your breath? Okay, hold it. Nice deep breath and hold it in. Okay. Go ahead and let it out. Okay, now I'm going to go from the bottom up, and I have to wait for the noise change. Okay. Okay, and that's 5 to 6 centimeters to check for diaphragmatic excursion, and that's normal. Okay. Okay, we need to check for tactile fremitus. I'm going to place my hands here on your back, and you're going to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Very good. Okay, and we're going to auscultate the posterior chest walls into the intravestibular spaces. And the sound should be nice and reticent. Okay, and I'm going to have you, I need to do the lateral side on each side too. Can you lift this side up first, so straight side up? Wonderful. Okay, and then I'm going to come over to the left side. Okay, we are completed with the posterior chest. Can you go ahead and turn back around? And we'll finish the anterior chest. We're going to inspect the anterior chest. Okay. The skin and your symmetry, your arms, your rate, your respiration, and your rhythm. Your rate is 18 or less. Respirations are at ease. No use of accessory muscles, no nasal flaring, and the rhythm is regular. There's no distress. And I'm going to inspect the pericardium here for any thrills or heaves. Palpate the apex of the heart, the left sternal border, the base, and the elbow. While I'm palpating these areas, I'm allowing for the cardiac movement to rise and fall of my hand and checking for any lip, heave, or thrills. I'm going to palpate the anterior chest walls, noting for any areas of tenderness or masses. I'm going to be palpating the intraclavicular node and the intra-axillary node. Go ahead. Okay. Is any of that sore to you? Okay. And then we're going to go ahead and repeat how we did it before. For tactile parameters, can you say 99?
99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. And then we're going to go ahead and check the intercostal spaces here again. Just expecting to hear the resonant sound. I'm moving systematically across the chest. Okay, now we are going to auscultate the cardiac sounds. First with the diaphragm of the stethoscope. We're going to start with the aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to turn around and use the bell of the stethoscope and repeat the aortic, the pulmonic, Erb's point, the tricuspid, and the mitral. Can you lay down on your left side, and we're going to do this again. Okay. And then now while we're laying down, we're going to assess the abdomen. So go ahead and lay on your back. And I got a blanket here. Okay. And you're covered. Okay. We're going to use tensional lighting. I'm going to get down here. And I'm looking horizontally for contour, any extra pulsations or movement. Your contour is nice and flat. I'm going to listen for vowel sounds, starting with the left upper quadrant. Thank you. I'm listening to each area for up to 2 minutes. If I do not hear vowel sounds, I can listen to up to 5 minutes in each area. Systematically, I'm assessing all 4 quadrants. Okay? Okay, moving to the bell of the stethoscope. I'm going to auscultate the aorta, the left renal artery, the left iliac, the left femoral, then the right femoral, the right iliac, and the right renal. Okay? Now I'm going to percuss the abdomen, moving systematically. We should be hearing tympani over air-filled areas and dullness over organs. Next, we're going to percuss the liver border, right mid-clavicular line, percussing downwards. I'm going to mark where you hear the sound change again, which should be 6 to 12 centimeters in between each line. And it is. Okay? Can you lay on your right side, Aubrey, for me, please? And we're going to percuss the spleen. We should not be able to feel the spleen. We need to take a mid-axillary line about the 6th rib. Okay, Aubrey, can you hold your breath for me? Mm-hmm. Okay, good. Okay, can you turn back over on your back, please? And we're going to systematically do light palpation, just over the abdomen and assessing the organs for placement, symmetry, masses, any tenderness. This is just real light palpation. And now I'm doing deep palpation, going symmetrically, symmetric pattern. And is this hurt at all?
No.
Okay. Can you take it? Okay, and I'm going to find the right costal margin. Okay. Take a deep breath in. And there's the liver border. Okay, go ahead and breathe out. And then I'm going to palpate the right kidney. Then I'm going to come over to the left kidney, palpating that. Okay. Yes, Aubrey, can you lean up ever so slightly? I'm going to palpate your abdominal accessory muscles. Okay, go ahead and lay that down. Okay, now I'm going to put my hand right here, and I'm going to palpate the aorta for any sensations, any abnormal thrills, heaves. Okay? Now we are ready to move for the assessment of legs and feet. Do you want to put your gown back on, or are you okay? Okay. Alrighty. We're going to look for skin color, tone, hair distribution, which is nicely shaped your legs. I'm going to go ahead and take your socks off, because we're going to be checking your pulses as well. Maybe. Okay, looking for any muscle mass, or looking at your muscle mass. You have much muscle mass, no atrophy, skin color is great, hair distribution is great, no lesions, no masses, no abnormal moles, and absolutely no bilateral lower extremity edema. Okay. I'm looking at your toes, and they're cold. Capillary refill, because you've got your toes painted, but I believe they're quick, they're brisk, they're less than 3 seconds for refill. And there's no abnormal color, peeling, or fungus noted. Okay, I'm going to palpate both your popliteal pulses. And I'm noting amplitude, rate, and rhythm. Posterior tibial. And then the dorsalis pedis. Again, for amplitude, rate, and rhythm. Nice pulses. Okay, can you step forward for me? Legs over the side, sorry. Oh, yeah. I'm sorry. Okay. Okay, we're going to test restraint. Can you put your arms out? Okay, try to lift my arms up. Okay, we're going to switch, push them down. Awesome. We're going to go this way. Okay, push my hands down. And the other way, push my hands up. Good. And we're going to assess your reflexes next. We're going to assess your brachial, radial, good. And then popliteal, just like your foot. I know that that's a little. There we go. And your Achilles. Okay. Okay, can you stand up for me and your back facing me? I'm going to check your cervical spine, inspect it. It's midline. Go ahead and bend over and with your arms dangling, I'm checking for any scoliosis, kyphosis. Your spine is nice and straight. Okay, and I need you to lay down on the bed one more time. And we're going to test some sensations of the leg. Can you close your eyes for me, Aubrey? I'm going to touch you with an object. I want you to tell me if it's sharp or dull. Sharp. I'm going to touch you with an object. I want you to tell me if it's sharp or dull. Sharp. Okay. Okay. Actually, this concludes our head-to-toe assessment. Let me help you up. Thank you, Aubrey. You've been a great patient. Thank you. You can turn it off.
All right.
We did it!